And you're live.
Okay, we are back. This is Senate Health and Welfare, and we're taking up H 464, which is an act relating to various miscellaneous changes to reach up. And we have both Representative Brumstead and Representative Small here with us. And if you guys sort out your testimony, that'd be great. So welcome, glad you're here.
Thank you. And so for the record, I'm Representative Jessica Brumstead from Shelburne and St. George, and thank you for having me here to talk a bit about H 464 and Representative Small, who did a lot of work on this over the summer as well, so to get us going. I wanted to just start out with a tiny bit of history. So about 25 years ago, the TANF legislation was passed in Washington, D.C. And then about 6 years later, so 19 years ago for Vermont established the Reach Up program inside of DCF with support from the TANF federal legislation. So Reach Up provides many Vermont families with the economic support to help them better meet their basic needs. The employment and job skill training to earn sustaining wages, early childhood care that fosters development during children's formative years, and services that prevent and mitigate childhood stress and trauma. Our committee was pleased to see that the mission and vision of the Reach Up program has evolved. The statute has not, but the actual mission and vision has changed to the mission is to join families on their journey to overcome obstacles, explore opportunities, improve their finances, and reach their goals. With the support of Reach Up's amazing staff, the director having been there the entire 19 years, not as the director, but she has worked in different roles inside of Reach Up, which is pretty incredible history that they have right there. And administrative spread throughout Vermont, families are empowered, connected, and thriving, and that's their vision. It's important that the statute reflect current program practice, and for us to modernize the law to be in line with today's research on best practices. Simplification is key for both the participating families and the program workers. But before I go into the changes we made in the bill, the main change being this, how do they work with families? So changing a bit of the language. I think something similar to what we're learning maybe is Parent Child. It's more about the policy, that there's some policy that needs updating after 19 years, as you might imagine. But before I get into that, I just want to remind the committee, what does it mean to be a Reach Up family? What does that mean? So I took a family of three, a parent with 2 children. So the family would qualify if there's no more than $9,000 in monetary assets and no other income except possibly a bit of child support. And you'll see why I bring that into this scenario. Say that this mom is out of work, having a hard time finding work because she cannot find affordable child care for her children and has no transportation. So this is just an example of the kinds of things. Once she enrolls in Reach Up, she would receive a basic needs allowance for her family of 3 of about $830 per month. So how does the state get to that amount? $1,236 would be the basic needs allowance, plus $400 for housing if she lives in any county other than Chittenden. If she lives in Chittenden, it would be $450. But remember, I think I said, oh, I didn't say that to you guys, but my scenario was a Barry mom, just so I could, because Montpelier has a few other little twists. But not if she can't find housing, really struggling, she can go back to the state and ask for an extra $90 with that $400 for special housing to help meet the true cost of housing, which can make some of us chuckle as you
Be struggling to find housing for under 500 with 2 kids in Barry.
Exactly. So that gets you to $1,726 total, minus the rateable reduction of 49.6%. So in Vermont, we use a 49.6% rateable reduction. What is the rateable reduction? It's a mechanism used by states to budget a specific amount on an annual basis. So looking at the total pot, how much can we afford? How do we get to that number? So we use a rateable reduction to do that. This leaves, just want to make sure I'm not losing my place. This leaves a little over $850 a month for this family of 3. And just so you know, in New Hampshire, for an example, their benefit is $1,000 for the same mom. This mom will then be matched with a DCF case manager who will help her qualify for other state programs as she works towards finding sustainable work in her future. So then I looked into, well, what are those other programs? What doesn't she have to take out of that $850? We know she has to take her housing out of that and then other expenses. All of the things that I found that she can also benefit from are not cash benefits. They go directly to what it is that they have. So they're not free for any discretion. So let me tell you what some of those are, and that becomes obvious. Medicaid, so she'll have her health insurance, right, with no premiums or deductibles. Some very low prescription copays, and all of that goes directly to the provider. 3 Squares, or SNAP, which right now is about, it went up for COVID, but it's about $500 a month. And that's on an EBT card. So at first I thought, well, that's kind of, she can make some choices there. That's true, but she can't buy sanitary products or diapers or paper towels or toilet paper with that. So she still had other expenses when she goes to the grocery store.
But she doesn't have to pay sales tax.
Right. Then she has low income heat energy assistance program, which is about $100 a month. Again, goes directly to the oil company. She has possibly Section 8 housing vouchers, which these days doesn't buy a lot because there isn't a lot out there. So a lot of people have the vouchers, but aren't able to use them. Child Care Financial Assistance Program, our CFAP, which is, she would receive the full subsidy because she's below 150% poverty. So that would be about $1,100 a month, but most child care centers these days are charging more than that. So there would be some copay depending on their sliding scale and what they do. And what we found as an average was that most Reach Out participants were finding they had to pay $25 a week per child. That can add up. So interestingly, when we passed H171, we said that we didn't want Reach Out participants to have to pay that anymore, that no copay. But when the IT system couldn't go into place, there wasn't really, they haven't updated that yet for Reach Up. So we asked those questions in committee, wanting them to be able to not be paying this. But a lot of times, you're a mom, you really want to take this job so you can stay on Reach Up. And so if your childcare is going to cost you a little more, you're going to try and pay it so that you can take the job and not be out of compliance with the Reach Out.
Actually, when we were looking at maybe the unionization of childcare workers, an awful lot there's the East Coast and the West Coast. In the middle, where there's a whole, where the majority of your kids were on the CFAP. The providers were collecting it. They just said, if I collect it, this kid's going hungry tonight.
Right, exactly.
But that put them under huge financial stress.
Absolutely, yeah, and you see that across the board in various places. But then there are other places, some places in Burlington that don't, they can easily fill up without,
Yes,
having this.
there's the West Coast and the East Coast, and then there's the rest of the state.
Yeah.
Washington County's kind of in the middle, but you get anywhere outside of Chittenden and the percentage of kids in poverty just escalates.
Right, absolutely. So that's to give you a sense of what is this. So let me talk a little bit about what this legislation does. Our committee worked together with DCF to update the statute. I think it's really important, most important, that we remember that this is an update in the language to make it less punitive and more supportive of meeting families where they are at. Research studies show huge impact on getting people back to work long-term when you look at small steps to get there. How do you get there, rather than just a quick job where they go off reach up and then back on reach up and then off. And so this is more, how do we work with the families to look at their goals and where they want to go. We heard from Donna Pavetti, who I'm sure you know, Madam Chair, who is from the Center on Budget and Policy Priorities, and talked about what they're trying to reform TANF programs throughout the country to be more like this. And so she helped us with some of the language as well. So now to go into some of the changes. We changed the definition of a dependent child to increase the age from 18 to 22 in order to allow youth to remain on the program so long as the dependent child is participating in a full-time school or vocational program. This change will mainly impact children with disabilities and makes the definition consistent with the DCF policy inside of the Family Services Division already. So this was seems like a no-brainer. The second thing, increasing the earned income disregard for working parents from $250 to $350 per month. And that is that if you're on reach up, you start working, right? You get to keep the first $250, and then you get to keep 25% of the total. The rest of the money stays with the state to pay off the benefit amount that I talked about earlier. Okay, so what we're suggesting in this legislation is that we move that to $350 from $250, so it's a $100 change. The third thing is increasing the child support disregard. So from $50 to $100 per month. Federal laws establish that all reach up participants must give up their right to receive child support upon going on the program. Currently, the child support that is paid by the non-custodial parent, that $50, is disregarded. So it goes to the family and has no impact on their reach up award from the custodial parent. This amount has not changed in 19 years, even though the federal government has updated guidance to allow up to $100 per child in child support. But yet we haven't updated our legislation. And what we're saying here is that we would update the legislation to disregard $100 per family, so not per child. So we're still not going as far as the federal government is allowing. The fourth is removing duplicative processes with regard to medical reviews for work deferments. This saves the department money. It's about $130,000 savings. And that is, right now, if you need a medical deferment, is the reason why you can't work, you would be with your regular doctor probably, you'd have the note, you'd get the paperwork filled out, that's your medical deferment. But Reach Up then had a second review of that. And they found that 99% of the time in that review always came out the same as what your physician had said and what the paperwork said. So they would like to do away with that. And actually the department came to us and asked to do that, to save that money. The fifth thing is allowing both participating parents to achieve higher education, so if there is, and there aren't a lot of families that are on Reach Up that have two parent, that they're married, but in the case where there is, allowing both of them to be able to achieve higher education. There's really no fiscal impact with this change because these families have already been eligible for the Reach Up grant, and it doesn't change that. And they would instead receive a grant, same amount, under the post-secondary education waiver program. As far as to whether there are Reach Up benefits to pay for the post-secondary program, which we did get some of those questions, they can go for an associate's degree, a bachelor's degree, a certificate or licensure program, any of those sort of things to improve their ability to have a good job. But though the money doesn't come through this program, the money comes through VSAC just like everyone else. And because they are so low income, they often do qualify for those scholarships. So it's more just our ability to let both be able to go to school.
Can I ask a question?
Yeah.
I'm sure you can get to it, but I can leave it here. What's that 853 become if this bill passed?
The 853. It doesn't change because we didn't change any of the only way that number would change would be if we either increase the housing allotment, that $400, or if we increased the 49.6%, the cut in half. What we're doing here is just changing, if you want to work, instead of just getting $250 pass through for what you did, you're going to get $350. So it gives you $100 more for that you've earned. So it means that they might pay off that $850, right? That the state is using the rest of the money for slower, because they would only be the minus that $100 extra. Same thing with the child support. It's not new per se, you know, and they're not adding to. We're just making it a little harder to pay.
There is a work required.
Yes, and I'm going to talk a little more about that. So this also edits the language to establish a universal engagement process that focuses on collaborative goal setting, updating the reach up statute. This is what I was saying earlier. This is all the policy. You'll see lots of cross-outs in the bill. And that's because we are changing the way we talk about the work requirement to be less punitive, but we're not taking away the work requirement. We're talking more now about step process. And to give you an example of that, something I talked about on the floor was we heard about a father and he had 3 little girls, and he was not complying with the work requirement because he couldn't keep a job. He kept going on and off and all of that. And then the worker, this is the new way that the worker works with people. Instead of just saying, oh, you haven't made the work requirement, we're going to start penalizing you the $75. Instead, the worker said to the father, what's going on for you? How can we help you? How can we help you meet your goal? We know, that you're trying to meet a goal and to be trained and all of that. And he said, honestly, I'm all alone in the world. I'm in this tiny apartment. I have 3 little girls, and I want to be a welder. And every time I start doing the classwork, I can't practice anywhere at home because I don't even have a clean shelf inside of my house that my kids won't get hurt. And so the worker went over to the house, worked with this person to find a designated space that was protected from the children. And now today he's working, and he talks about how he's a welder, he feels really good, and his kids are seeing him get up every morning. So that's sort of how the policy has changed. We're trying to find the language that makes it more about that, more about asking people, what are your dreams? What are your hopes? What would you like to be doing? And a lot of times they just break down because no one in their life of poverty, no one's ever asked them that question. And so that's really a big change, and we wanted the language to catch up and to reflect all of that. So I'm trying to, essentially I could go on because I have lots written here, and I'm happy to do that, but maybe it's better to just answer questions. That's essentially what the bill does. I've told you that.
No, this is very helpful. You've given us the full background that we'll need to understand as we go through the bill. So this is really very good.
And I don't know.
Representative Small wanted to add.
Would you like to add
Comments?
What about that?
I have plenty of comments to add about the region program. But I think what's most important for the record, Taylor Small, Representative Taylor Small from Winooski. I think the most substantial piece of this bill is the crossouts later on, when we're moving away from the work requirements to work preparedness. And I think Representative Brumsted did a wonderful job of talking about that goal-setting process that is currently being used in the Reach Up program, but that what we heard through testimony is that there's this conflict for case managers of statute that is very punitive and focuses on sanctions for families that aren't working, when their desire is to work with those families to see what are the barriers and how they can get there. So I think with this change of language, it's going to focus more on meeting those goals along the way, rather than having to think about sanctions. Or it also removes the need for significant deferments from work participation, because now we're seeing workforce and getting back into the workforce as a continuum of what that means, and really understanding that families in this program have significant barriers to work.
Thank you.
And the only thing I would add to that, and I know Nolan's going to talk to you about this, but there are two expenses, right? The cost of upgrading the IT systems in order to go from 250 to 350, and the cost, and then the other IT piece is the child support change, from $50 to $100. The department is telling us that's 500,000. I mean, and that's what Nolan will say, but I'm skeptical about that, because those numbers are it's not like we're not already doing those two actions. We're just changing the amount.
Yeah.
So it seems like it might be less, but I'll leave that for you all to decide. But also remember, and then the other piece, the increase in the, being able to keep more of the money would be about somewhere between 284,000 and 314,000, which seems, this is really more about policy, not really about money.
Wait till it gets down the hall.
Yeah, it's in the budget that came over.
This is a getting more money to these families.
Yes.
Is a primary goal of the chair of the folks. Oh, no, we're all given her background.
It's important to mention in that case that we also did put into the budget, the amount of money, I'm forgetting, it's 3.7 million, 4.7 million that the administration dropped to the bottom line for Reach Up. But last year, remember, we said, let's keep that money in the program, and even if they don't use it all on the number of participants, what about using it for special stabilization projects or giving them a cash benefit? Because as I showed, they don't have that much money that actually comes to them as with flexible use. So we advocated for that again this year, but our appropriations committee took it out. So it's not in the budget, but that you guys will probably talk about that on another level, and I don't want to mix things, but on the other hand, I can't help but say I will.
I have a question about the IT piece, and does this at all link in with the integrated eligibility work that's going on? Is this totally separate?
That, I think you're talking about the child care financial assistance program?
No, I'm talking about integrated eligibility out of the economic services division to determine eligibility for various programs.
They didn't say
They
that.
didn't talk about that. Okay.
So I don't know, that maybe that's why it's so much, or maybe they want to use some money that they get for this to help them with that. I really don't know, because it seemed odd to me that they came up with
we
that.
haven't heard recently where that development is, so.
We heard a lot about it when
It's kind of gotten quiet, and I don't know what's going on with it, but.
If I may, Madam Chair.
Certainly.
I think a significant piece in where the IT updates are is between the Economic Services Division and the Office of Child Support. So having those two communicate and recognizing that there are significant IT updates that we need in the state.
Actually, that's very helpful. And then, did you folks talk at all in committee about the child tax credits and how that might offset need within the Reach Up program?
we talked about it in the appropriations committee.
Yeah.
It came up, the cost of the child care tax credits between 48 and 50 million. It mostly will hit, these folks aren't paying taxes that they would get a credit on as much,
Or
right?
refundable, so they would get.
They would get some, yeah.
Yeah,
Yeah, that's true, they would get something.
they would get some. But if you don't know taxes, how
How
the,
does that work?
well, it's in my committee, we'll find out. It's gonna be in finance, we're gonna.
Okay, good, I'd love to know the answer to that too. 'cause-
There's gotta be a base there somewhere.
Represented small.
Yes, one piece I will add is when we were considering the child tax credit, we made sure that it was in those two payment forms instead of a monthly payment to families. And because of that, it actually does not have a fiscal impact on the families of reach up. It would not impact their award, is my understanding currently.
Because
Okay.
remember that $300 that came from the government from the federal government did impact their award.
Okay.
So,
That's good. Okay,
okay,
thank you, thank you.
and I'm happy to share, I don't know who's reporting this, but when you guys decide that too, I'm happy to share the
Okay.
actual report. I
Whoever
did.
reports it will
And I'd
be,
love to do that with parent child too, so whoever report it on your side. Thank you very much.
thank you. Terrific. So we'll, Katie. Here we are.
So much.
Oh, I'm glad, thank you, thanks both.
Hello.
All right, good morning.
Good morning. So this morning, Katie McGlynn, Office of Legislative Counsel. So we're looking at H 464 is passed the House. And as Representative Brumson said, it's quite a long bill, but you'll see, especially in the second half of the bill, there are a lot of strike-throughs of language that's being removed. So that accounts for a lot of sort of the page count. But first, section 1, we have a definition section. And this piece of changing the age for a dependent child from 19 to 22 years of age, this is the language Representative Brumstead was referencing about allowing kids to complete an educational program, and that the impact there would probably in most cases be impacting children with disabilities. Section 2 is the eligibility and benefit levels. And on page 2, you'll see that income disregard and subdivision C1 is being changed from the 250 to 350. What's happening in paragraphs 1 and 2, you'll see paragraph 2 is being struck through. That paragraph had pertained only to subsidized jobs. So basically, unsubsidized jobs and subsidized jobs are being combined into one paragraph and treated the same with the same income disregard. And then in subsection F at the very bottom of page 2 is updating the child support payment from $50 to $100. And then you'll see sort of the continuation of that on page 3. This is the specific section on child support payments, and you'll see that change from $50 to $100. So it's consistent throughout. And then we get to section 4, which is case management and family development plans. And then we have sort of a list in subdivision A1 of what informs the case management plan. So it's informed by knowledge of the families and the added language as goals and aspirations, circumstances, existing language, home, community, employment. So we'll see a lot of language like that that's sort of more goal oriented.
And more focus on the family.
Right, exactly. On page 4, the language that the services may be delivered in the district office, the family's home, or the community in a way that facilitates progress towards accomplishment of the family development plan, consistent with research on best practices. And then case management may be provided to other eligible families, that's existing law. And then in terms of putting the plan together, the new language is that the case manager and family together shall create a family development plan for each participating family. And what's being removed, there have been language about full involvement of the family, which has sort of a different connotation that the caseworker and the family are working together. And then at the bottom of that subdivision 1, there's a removal of a sentence. The language has more of a less of a cooperative tone, that the applicant or recipient for financial assistance under this chapter shall have the burden of demonstrating the existence of his or her condition.
Sounds really,
So that's being
Yeah.
removed.
Yeah.
There's a new subdivision 2. Case managers are to use a universal engagement model that aims to engage each participating family to the best of their ability in improving the family's social, emotional, and economic well-being. The universal engagement model approaches work and workforce development as a continuum in which each participating adult who is able participates in work or the process of preparing for work, participates in training and education, and increases the participating family's income. A participating adult who is unable to participate due to extenuating personal or family challenges shall be excused from the program participation requirements until able to participate. And it's a role.
does universal engagement model have a definition?
It's not in the bill.
Probably should,
It seems like a term of art that the department was using, so I think we could probably
yeah,
ask the experts at the department to,
just give us a little
give us a
definition and
definition and if it needs
put
to
it
be
in
plugged
because it could change or, I don't know.
Sure. Okay, so I will thoroughly flag that piece so we can
Yes,
come back
please.
to that. Okay. The next section, section 5 on page 5, if you remember, maybe 8 years ago, there was the language around the 60-month cap that was for the program, the REACH program that this committee worked on. So this amends that section. So existing law says that except for where the grants to children, and except for where there's kin care, if a family has fewer than 60 cumulative months of financial assistance in which the family has not been granted a deferment, including those months in which any type of cash assistance funded by TANF was received in other states or territories, they're eligible for reach-ups. So that's sort of setting out the cap in subsection A. And then at the top of page 6, subsection B is a list of deferments. So this isn't so much creating new deferments as sort of amending the existing deferments, but they're that the participant is not able to work. The participant is a parent or caretaker who is caring for a child under 1 year of age. Third, the participant is affected by domestic violence. Fourth, the participant is needed in home on a full-time basis to care for an ill or disabled parent, spouse, or child. And there's kind of rulemaking built into each of these that sort of the specifics will be spelled out in rule. Subsection C is more of a grammatical change than anything else. And then subsection D is saying, even though we have this 60-month cap, a participating family that does not meet any of the criteria, any of the deferments we just looked at in subsection B, and has exceeded that cap, they shall qualify for a hardship exemption that allows the adult of the participating family to continue to receive financial assistance if the participating adult is engaged with any of the work activities listed in the chapter, with one exception.
So, I mean, so essentially, if you have a kid under the age of 1, it's like having a family leave program.
It doesn't count towards your 60-month cap.
Yeah,
Yes, it is.
yes,
We did discuss that when we did family leave.
yes.
You're on welfare.
Yeah.
Get paid and you don't have to work for a year after childbirth. If you work, you don't have to work, and you get 6 weeks unpaid.
Doesn't seem right.
No, it doesn't.
Doesn't.
The bill would have given you 6 months or 3 months.
I forget.
The grandson, I put the bill in after he was born in Canada, and his mother did get a year paid, not, it was an unemployment payment. He turned 14 in January. So it's been a long time coming. We're still.
So subsection E at the bottom of page 7 is new in this paragraph. So sort of is what if you don't qualify for the hardship exemption? So you have the 60-month cap, you have the deferments, you have the hardship exemption, you don't qualify for the hardship exemption. The family may be eligible to continue receiving benefits under REACH-UP if the program director or the program director's designee determines on a monthly basis the participating adult is actively participating in the universal engagement model, including the process of planning and engaging in goal achievement related to employment, training, education, and addressing obstacles. That brings us to the top of page 8. And here we have language about the family development plan, and there's a new subdivision A2, which has to do with the process, the engagement process for developing the family development plan. So the process of developing a plan shall include planning and engaging in goal achievement related to employment, training, and education, addressing obstacles to employment, following through with established steps to achieve goals, reviewing and revising goals as necessary, and setting new goals and each existing goal is achieved. And then we get to section 7, which is currently a section that has to do with work requirements. And this is really where we get to see a lot of the struck through language. So a lot of this section on work requirements goes through different scenarios. If there's a one-parent family with kids over a certain age, they're working this many hours. If it's a two-parent family with so many kids over an age, they're working that many hours. So that language is pretty much gone in this version as passed the House. And what remains is that each participating adult in a family receiving financial assistance grant shall participate in the process of planning and engaging in goal achievement. These goals may be related to family well-being, financial stability, employment, training, education, and addressing obstacles to employment. Participating families shall participate in establishing goals and steps to achieve goals, reviewing and revising goals as necessary, and setting new goals as each new goal is achieved. And then subsection B, we're removing that sort of prescriptive. Subsection B1 is language about when the work requirement becomes effective. So that language is gone, and on page 10, what remains is the sentence, program participation requirement shall become effective as soon as the participating adult becomes eligible for financial assistance. And subsection C, so subsection C has lead-in language, and then a few pages later, we kind of finish the thought. So maybe I'll just tell you what this does. So this is really where we get into the different scenario language, and it's all struck through. And instead, there is a list of activities that will count towards program participation, and we'll get to that in a page or two. So this lead-in language is a participating adult may meet program participation requirements through including the following activities through one or combination of work, education, training, or other activities that address the family's goal and well-being. And then we look at the list. As an aside, when I was going through this again this morning, I sort of thought that the phrase including the following activities should be at the end of this lead-in language. So I flag it, and maybe that's a change the committee will be interested in making. I think it might read a little bit more clearly. So I'm going to skip page 11, which is, the existing language, the different scenarios, and bring us to page 12. And at the top of page 12, if you sort of imagine that the one from the page a couple pages over has carried over. So this first item on the list is employment, either full-time or part-time. Activities that develop and enhance the skills employers need their employees to have in the workplace, including career-specific training programs, English language learning, literacy and math skill courses or credential programs, entrepreneurship and business development, job search and career exploration, including engaging in work experience or participating in job shadow opportunities, education, including obtaining a high school diploma, technical training and vocation education or career-specific education, building foundations for employment, including housing search efforts, arranging transportation, or arranging childcare, activities aimed at improving family and financial well-being, including financial capability classes and coaching, mental health treatment, treatment for substance use disorder, working with children's health and school professionals, applying for SSI, or working with the Division of Family Services, or any other activity designated by the commissioner in accordance with rule. So those are the new sort of program participation requirements, those activities.
So the rulemaking for this is it later on, or is it updating the reference anywhere else?
There's no specific new added directive to dual
Okay.
rulemaking other than what's embedded, saying that
Yeah.
certain things are required by rule. So
Yeah.
I would assume the department would have to take advantage of that rulemaking authority to put this into effect.
Okay.
Oh, actually, in the effective date, the effective date takes effect a certain date, except the department can start the process to adopt rules before the effective date, so the rules are ready when the language comes into effect. Okay. So subsection D, as you see, is all struck. This was language about accepting any unsubsidized job in the situation in which you can do that. On page 15, there was language about somebody who's done the TSC program, the secondary education program. They don't have to accept a job for 3 months that's unrelated to the training they did and certain criteria met. So that language is being struck here. And instead, on the bottom of page 15, there's new language. A participating adult shall be deemed to meet the program participation requirements if the adult is participating in activities that lead to employment based on goal setting and active universal engagement, excuse me.
So we need to define the universal engagement stuff.
Yeah, well, it's interesting because this is using active universal engagement.
Yeah.
We also use universal engagement model.
Yeah.
So maybe a conversation about consistent terms, or if there's a reason to
Yeah.
use two different terms.
Yeah, so we should define the model, but then using it here would suggest it's part of the model. I don't
Yeah.
know. Yeah, we'll have to ask that.
Okay. I'll make a note of that too. Under subsection E, we're striking that language out. This is language that the commissioner may require participant to participate in job search for a certain number of hours a week. So that language would be removed under this proposal. And then on page 16, we're just updating the subsection designation. And instead of referring to a participant's hours of unpaid work activities, why did that change?
So it's the
Well, really all that's being struck is a participant's hours, and we're just talking about unpaid work activities.
yes,
So it's sort of striking something and putting it back in, but it doesn't.
it's like they're trying to ensure that people aren't taken advantage of.
Yeah, for the drafting,
Okay.
unpaid work activities is struck and then added back in. So more house
Oh,
cleaning,
got it.
yeah, and anything else is what I'm stuck on there. Okay. Section 8 has to do with deferments. And there's again a lot of strike through here. Subsection A sort of sets up the process for granting deferments. Subsection B lists the types of deferments. And you'll see that all struck on page 17, 18, 19. These are all different types of deferments. On page 20, I'll flag for you subsection D. This is the language Representative Brumsted was talking about the medical review having, and this is the piece that would be this annual savings of 130,000 by not requiring that medical review. So this is where that language currently lives in statute. And then all that remains in this deferment section is that the program participation requirements shall be deferred when a participating adult is 60 years of age or older, a participating adult is caring for a child under 6 weeks of age, a participating adult for whom due to the effects of domestic violence, engaging in the program participation requirements can be reasonably anticipated to result in serious physical or emotional harm to the participating adult or child, or any other participant designated by the commissioner pursuant to rule. And then section 9 is our sanction section. And the changes here are again to have kind of transition to language that has more of a collaborative feel. So you'll see instead of if a participating adult fails, it says if a participating adult does not engage without good cause to fully, let's see, without good cause, family development plan or program participation. So it's sort of that transition from failing to not engaging. And subsection B, again, sort of the same language at the top of page 22, moving from a participant's non-compliance to participant's non-engagement. You'll see that in subsection C as well, in which a participating adult is not engaged versus not in compliance with the family development plan or work requirement. And then wherever we're talking about work requirement, we're updating it to program participation requirements. That's the big long list that we went over. Subdivision C2, again, sort of these same types of changes, moving from non-engagement or non-compliance language to non-engagement language. So we're switching out in compliance with the word engaged, moving from work requirement to program participation requirements. Same changes in subsection D, instead of coming into compliance, using the word engaging. In subsection H, there's language that's being struck that has some specificity with the location of the meeting with the case manager. And then in subsection I, language about what happens if there's failure to meet the work development plan. That language is being repealed under this proposal. And then section 10, page 24, this is the post-secondary education program. So right now, only one adult in the family can participate in the post-secondary education program at a time. So this amendment changes it to allow both parents and the family to participate in PSC at the same time. So those changes, instead of the participating parent in the lead-in language, a participating parent. Page 25, subdivision E1. Right now, there's language that says no more than one parent per family may participate at the same time. That would be repealed. Also in subdivision 2, if the participating parent is in a two-parent family, the non-participating parent, if able to work, shall be working full-time, etc. So that would be repealed. And then you'll see that there's language about the participating parent. It's been changed to a participating parent in subdivision 3. And the same changes all the way down each subdivision on page 26, moving from the participating parent to a participating parent to recognize that it could be either or both parents participating. And then that brings us to page 27, the appropriation. So this is the technology appropriation that Representative Brumstead mentioned. This is the $500,000 to DCF to make improvements to the department's information technology systems necessary to effect changes to the REACH program required in this act. The effective date. So the effective date, the bill itself in section 11 would take effect this July 1, 2022. Everything else wouldn't take effect until January 1, 2024. And then we have that exception that prior to the new sections taking effect, the commissioner could adopt rules.
Oh, questions for Katie. This is like deja vu all over again, going through reach up and TANF. how many times. But the language is so much more engaging. All right, and we have this in the little spreadsheet. Questions, comments? I'm thinking if we're interested in sending the bill further, we probably should hear from DCF, from Reach Up folks. We'll do that. We'll try and get them in on the bill. And then it's going to have a little pathway to go. And I know that if we're thinking at all about the tax credits and how it relates to this, which I apparently was also discussed a little bit, at least in the House, that both finance and appropriations will be taking a look at this. I'm not hearing anyone who doesn't want to. Is there anyone who thinks we shouldn't do? I think there's a lot of good changes here for people. Okay, so we'll get some folks in on the bill, and Katie can help us with that.
Is there still a low-income advocacy council?
Huh?
The low-income advocacy council, are they
I don't know.
still around? I would assume so.
Are they not? Yeah, I haven't heard.
I mean, that's where
Yeah.
I mean, this goes from being punitive to being, we really want, you have to get a job,
Yeah.
minimum wage,
How
a
can we
job.
help you?
This says, we want to get you off of what? We want to help you get the skills to get there. And
And
understanding
this
it.
with programs that will help, keep you from addiction or whatever other
More like
issues.
old-fashioned social work.
So we do
Let's just
have
take over
folks
that
coming in next week on the bill.
$853 number I can't go over.
For which? Oh, yeah,
For how little for a family.
yeah. Sure.
80% of potential choose to be the secretary.
Yes, and all ones.
I just want to remind you that there's fiscal note. So,
Oh, yeah, that, darn.
Are you asking for my seat?
no, I'm not asking for anything. I'm just reminding
Please,
you.
that would be
fiscal note.
terrific. That would be terrific. We'll play musical chairs.
Very best.
Thank you. Directed, all night while we join this office. The joke is usually like, I'll make it quick because I'm what's standing between you and lunch, but actually I'll make it quick because you're what's standing between me and lunch, so
It's been a long one.
it's been a long morning.
I use that line.
But I got to spend a lot of quality time with you today.
Well, and we're glad about that. It's
Me
all-
too.
Yes, it's good.
I'm gonna keep it really brief. I have
Okay.
fiscal note, it's posted. If you go to the second page of the fiscal note, I'll just focus on the summary. I
Okay.
don't think I need to rehash things. I think Katie did a great job walking you through it. I'll just highlight a couple things. I broke it up into 2 fiscal years because there are a lot of effective dates that don't take effect until January of 2024. So at the top, you have sections 8 and section 11. So for fiscal year 23, section 8 postpones the elimination of the medical review team. So the governor had put the savings of $130,000 in the budget. This postpones it until fiscal year 24. So it had to be added back to the budget. So it actually is a fiscal impact because it's added back to the budget. Why it was added back and postponed, I couldn't really speak to that.
Yeah.
And then, as was discussed, the Representative Brooks had talked about the $500,000 for IT. I don't remember off the top of my head, but they seem to have a very rational explanation for why it costs so much. That tends to also be, whenever we do things, that tends to be the number. Is it too high? Maybe, maybe not, but that tends to be in the ballpark of what I'm told IT changes have to do because it's a certain amount of time and hours and so people can do it, et cetera. So I'm not going to get into whether I think the number's too high or not. I'm gonna go with what DCF told me it costs. And that's what's in there. So that's a one-time appropriation. So fiscal year 24 is where the bulk of the work happens. And part of, well, I don't know that I could speak to that. What I'll say is that because a lot of the work doesn't take effect till midway through fiscal year 24, there's no 23 impact. But there are 24 impacts. And since it's a January start, which is the middle of the fiscal year, it's a half-year impact.
Right.
So starting halfway through fiscal 24, raising this, part of the reason I think there was a delay was to give the DCF time to do the work. So, but anyway, you can hear from them why the delay was there. Like I did so many fiscal notes, can't remember what was what anymore. Raising the age from 19 to 22. Annualized is 43,000 since it's a half year, cost is 21,500. Increasing the monthly unsubsidized earned income disregard from 250 to 350. There was a range in there. It was between 185 to $215,000 annualized. Again, since it's a half year cost, I broke that in half.
This is total cost you're sharing with us here, or not? Or is that for one person?
That's total cost program.
Wow. Why didn't we do that before?
Increase the monthly child support pass-through from 50 to 100. That's an annualized cost of 186,000, so it's 93.5. And now the elimination of the medical review team. Now, since the effective date is tied to the others, and it's halfway through, you're seeing that savings in 24, half of them. So that is the 22,000 foot overview.
Okay. Questions for Nolan?
Well, I'm very supportive of the bill. I'm not trying to be difficult, but can we get a better explanation from DCF as to why they need $500,000 for IT upgrades?
Yes, we'll answer that question
Yeah,
later next week.
And
It's a lot of money.
They're getting paid on a wage scale that can't.
well, let me see here.
Did you have that information?
All right, so here it is. Legislation, we need IT updates. This is a memo that was provided to me. We need IT updates for both Economic Services Division, Office of Child Support, and 3 Squares and SNAP. Based on the level of work and the outside contract, it touches multiple programs. Their high-level estimate for this work comes out 2,500 developer hours. The estimate includes programming, systems integration testing, user testing, subsequent desk review process. It's created knowing that there are 3 items on. So there's this level of effort would have to be completed by a contract because at this time they do not have the IT staff to do the work. So this was a high level. I do remember now, it's all coming back to me, that I did challenge them on this.
On the amount?
On the amount.
Yeah.
And initially I had sort of knocked down the estimate, but at the end we put it all in.
Okay.
So I think that one approach would be we put all of it in because we knew that if they didn't use it all, it would drop to the bottom line and would be, used some way or another. So I think so it's all coming back. We did challenge them initially. We weren't going to do it. And then we decided we would do it. With appropriation decided to do it because the money would drop to the bottom line. And it was the other option you could do is if you decided to cut the appropriation and they think it's more, they can come back in BAA and ask for more. Not only
When we say it's drop to the bottom line,
Yeah.
when we say it's drop to the bottom line, though, that doesn't ever revert back to, it's gonna go back to the taxpayers who funded the Sarah to lower their taxes.
Yes and no. It doesn't go back to their taxes, but it gets counted against future appropriations. So it's future money that taxpayers don't have.
Back to the general.
So the answer is yes and no. They don't just keep the money in pocket.
Well, I didn't assume that.
Yeah.
You could see how it could quickly see a pot of money and say, all right, let's spend it on.
They don't. They have to account for that with us. So there's budget adjustment and other forms of accountability tools that you as a legislature have to hold them accountable. But your point is okay.
Thank you.
And there's revisions.
Okay, well, we have questions to ask of them, and I'm still interested in how it integrates with the integrated eligibility. If,
Not full scope work required to provide access, talk about access changes.
yeah,
I'll let
but
them.
it said economic services, they can have a little clicker. Okay, any other questions for Nolan? Katie? So we'll go ahead with this bill, and, we're finishing early this morning, so if there are any further thoughts that folks have, sure, go ahead.
Appointments, I have one. And then I also wanted to ask you about, well, you all probably heard the news about Kevin Mullen retiring. The news about Kevin Mullen retiring.
Yes,
Yeah, so there was also a Green Mountain Care Board member that was appointed last year. We didn't have that, we should have reviewed that one. That wasn't on our list.
we didn't get it from the governor.
We should,
Yeah.
because Green Mountain Care Boards they actually require a floor vote. We did one last year and we did a roll call vote, so could Aaron reach out and ask why we haven't gotten that one?
Yes, we haven't gotten Jenny Samuelson, Secretary of Agency of Human Services, and we haven't gotten the new guy.
Yeah.
Careful.
It just occurred to me yesterday when I
I
heard the news
know,
about
when you saw
Kevin,
the
I was
news.
like, wait, there was another new one and we haven't heard that from the
Well,
person yet.
Yes, so, yeah, we'll do that, and that reminds me about confirmations generally, and if anybody has any updates on their confirmations, good time.
I have one, I don't have his resume, but I've had a long conversation with him.
It's okay, that's good, why don't we, have that conversation right now?
But wait a second, now I'm like blanking on his name. That's not good.
Aaron has a list.
Did I have any of that?
You have one.
Yeah, well, Aaron, that's a good idea, Ruth, we'll have Aaron reach out and see, if there are any other confirmations coming our way, we should do that.
Is it Michael Donahue?
That's right, thank you. I knew it was an M name. Apologies, Michael, if you're listening.
I wouldn't know, I knew the name, so it's Josh.
Oh, and we also have on our webpage, we now have the fiscal note for 703, which is the workforce development bill, which will be.
Okay, I need time.
Are you
to
ready?
No, I need time to dig it out of my notes, so
Okay.
I'm sorry,
Okay, well, we'll do that, we'll take some time, maybe Friday. Is today Thursday?
Today's Thursday.
Let's do it tomorrow.
okay, I don't, cause I'm ready for it, but I just would rather.
Yeah, no,
have
that's
the
fine,
information
that's
from
fine.
you. The other thing is, H-153, nice Katie is gone, but, I don't know if you saw the email, I'm not gonna do an amendment on that.
No, good, I was happy to hear that.
Yeah, so if you wanna get Katie back, we could vote that one out, unless other people have things.
I think
but
we have it on our schedule for tomorrow.
Tomorrow.
Yeah, so we'll do that, Katie's left, and, so we'll do that tomorrow.
Okay.
H-153.
It is Jen's bill.
So
you're
I
right.
added, no, long-term care.
It is, Jen
But
did
Jen's
draft
doing it
yeah,
because of the, yeah,
Yeah, 'cause it-
yeah,
Anyways.
okay.
um,
Okay, so let's go off, you two. Kind of finished up our